So next is ureteric injury, and it is V15, and 65-year-old man presents with a bulky left lower colonic tumor extending to the upper rectum. What are the other structures at risk? So left ureter as it enters the pelvic brim. What planning definitive surgery? What would be the most appropriate preoperative investigation to access this? Ureteric involvement is best assessed by the delayed phase CT scan or CT urogram. What preoperative measures can be taken which may aid in the identification of interpretability? So it's stenting. So double J stent from the ureter can be placed, and nowadays lactate stents are placed. So it help in identification of the ureter intraoperatively. But the stent-related complications there, like infection, hematuria, oliguria, describe the course of the ureter. The right ureter, they are divided into proximal, middle, and the distal. It may also be divided into the abdominal, pelvic, and the intramural. The right ureter begins behind the descending part of the duodenum and descends lateral to the inferior vena cava and the ureter just below its origin. The ureter is crossed by the gonadal vessels, testicular in the male, ovarian female. The right ureter is also crossed entirely by the right colic vessels, the root of mesentery and terminal ileum. At the pelvic brim, it crosses over the bifurcation of the common iliac vessels. Upon entering the pelvic brim, the ureter courses medially and passes between the vas deferens anteriorly and seminal glands posteriorly. Vas deferens anteriorly and seminal vesicles posteriorly. Left ureter arises posterior to the jejunum and descends lateral to the aorta. It is crossed by the testicular artery, left colic artery, and mesentery of the sigmoid colon inferiorly. At the pelvic brim, it crosses over the bifurcation of the common iliac vessels. Upon entering the pelvis, the ureter courses medially and passes between the vas deferens anteriorly and seminal vesicles posteriorly. What is the most common site of ureteric injury during the colonic injury? It's at the level of the pelvic brim. If the ureter is inadvertently injured during surgery, what factors will help determine the most appropriate method of repair? It depends on the level of ureteric injury, the mode of injury like scalpel, scissors, or harmonic, and complete or incomplete transaction. What are the principles of ureteric repair? Principles of ureteric repair. Debridement of the non-viable tissue back to the normal healthy bleeding tissue, spatulation of the ureter, and tension-free anastomosis mucosa with absorbable sutures, and placement of ureteric stent and drain insertion. Thank you.